Welcome back. We are kicking off what we hope will be 3 weeks of critical conversations about where we are in this pandemic in our own community and where we go from here, what happens next, what we hope will happen next. We are joined now by Dr. Jose Plata, Trinity University Medical Director for COVID-19 Management. We should say that over the next 3 weeks, we will be talking to many different experts that Trinity University has been kind enough to provide us to give us some guidance on where we stand. So let's start right there, Dr. Plata. What do you think is important for people to know about where we are at this stage in this pandemic? We've been weathering it for 9 months. It's definitely caused COVID fatigue, as they say. So what do people need to keep in mind about right now?
We should definitely keep in mind our loved ones. We are all tired of being cooped up at home, changing our life, the way we interact with people over Thanksgiving, over Christmas coming up, but we cannot give up just yet. We have to continue staying 6 feet away, wearing our mask, and know that hope is on the way. Vaccines are coming and hopefully should be rolling out in the next few months. So we just have a little bit longer. We're almost there.
Is that your message to students and faculty and professors that you see on the Trinity campus right now? Hang in there, we're almost there. I know you guys went on break, but even before you went on break.
Absolutely. Trinity has done a fantastic job at doing all the social distancing and mask mandates throughout campus. Students have been very open to letting us know when they see people violating these restrictions because they know their future is at risk. If they don't follow these instructions, they may not complete the semester as needed. And same goes for all of us. If we don't do what we're supposed to, we're going to have weddings postponed. We're going to have Christmas in the ICU instead of at home. So absolutely, that's what we're doing on campus, and it's working out for us so far.
I think it's really interesting how so many different facets of our community have handled COVID-19 and have put protections in place. Before the Thanksgiving holiday, we heard about if college students are coming home, perhaps have them tested for COVID before they come back into the house and interact with mom and dad or siblings. So talk a little bit about what plans have been put in place on the Trinity University campus to protect that all-important age group of, the young 20-somethings that we've really seen so many COVID-19 cases emerge within that group. So what's happening at Trinity to prevent the spread?
So even though they may be young and half of the time their symptoms are very mild to none, we still need to protect these young population because we don't know what COVID may have in the future for them. Heart inflammation, kidney damage, we just don't know that yet. So what has Trinity done? Trinity has implemented mass testing. So when students return to campus on spring, they will all be retested. We did the same thing for the fall. In addition, we're testing high-risk groups within campus on a weekly basis. Even our faculty, when they return to campus this week and next week to get classes ready and their labs ready and research restarted, we're going to be retesting them to make sure that after their Thanksgiving travels and their upcoming Christmas events, that they come back to campus with negative statuses. And if they're positive, we have plans implemented to be able to take care of them as best as we can.
Dr. Jose Plata is joining us right now as we continue this COVID conversation, and we want you to be part of it as well. If you're watching online on KSAT.com or on the Tiger Network at Trinity University, we welcome questions. And a lot of the questions that we've been getting so far, Doctor, have to do with the vaccine. Specifically, if you have had COVID already, if you've tested for the antibodies or you know you've had COVID, should you still get vaccinated when these vaccines become available?
I would definitely do it. I had COVID back in June, and I would not want to go through those symptoms again, or much less put my loved ones at risk to getting that. COVID is real, and it's not a disease that can easily be battled. So absolutely, we should get the vaccine. On top of that, we have studies that show, antibodies can be present, but the levels are variable for everyone. So you don't know if you have enough antibodies to provide immunity. Whereas the vaccine, the new vaccines that we have out there will provide immunity for you. So for yourself and for your loved ones, get the vaccine, even if you've had COVID-19.
What was it like for you? I'm curious, as a doctor going through COVID-19, you said you had it. What was it like for you?
It's very surreal because it was brand new still in June. Studies were coming out. There's all these Facebook groups where a lot of physicians and advanced practitioners have joined to go over COVID management, COVID symptoms, what has the rest of the country been doing. And to see it on paper and actually live to it are two different things. So knowing that when the sense of smell left, I knew exactly that it was COVID. When the second week came back and I had chest pain and shortness of breath, definitely I knew I had complications of COVID. So as physicians, we make very poor patients. However, I knew what was happening. I was able to manage it. However, because of that, the knowledge and the experience, I tell my patients, I tell my loved ones, please take care of yourself. Don't go through it like I did.
Such an interesting perspective to give us in terms of how you handled it, knowing what you know about this disease. We are going to continue our conversation with Trinity University COVID-19 Medical Director coming up after the break.
Welcome back to our conversation on coronavirus, where we are right now, where we are going, and its impact on San Antonio and South Texas. We are joined by Dr. Jose Plata from Trinity University. Doctor, thank you for being with us. And one of the questions that we received while we were talking during this whole thing had to do with how some of these vaccines are stored. I believe it's the one from Pfizer that are stored at super cold temperatures. Why do they have to be stored at that temperature?
Really, it has to do with the preservation of the proteins. These two vaccines, both from Moderna and Pfizer, are created by a new standard of vaccine. So in the past, vaccines were done by injecting small proteins of a dead or alive virus, whereas the new COVID vaccines are what we call mRNA or messenger RNA vaccines. These are very brand new, state of the art, and what they do is they teach the body how to create these proteins. So in order to preserve this mRNA and the way it was created by Pfizer, it has to be kept at these extremely cold temperatures.
Dr. Plata, I think there's a lot of confusion about what the vaccine is intended to do. Is it supposed to prevent people from getting COVID-19 altogether, or is it supposed to prevent us from getting perhaps some of the most severe symptoms? Do we know at this point what the intention is with the vaccine?
Yeah, so what Moderna did, they tested 30,000 people, and from this vaccine, they realized that no one on the arm of the study who got the COVID vaccine had severe symptoms. So you guys may know already the severe symptoms for COVID-19 include ICU admission for inability to breathe, chest pain, and a lot of other comorbidities that can be exacerbated. So if you have kidney disease, you can get on dialysis. So it's definitely supposed to prevent severe disease, and it's also supposed to prevent from you even getting the disease. So from the arm who was exposed to it, only about 12 people got COVID-19 and none of them had a severe. So it's supposed to be all of the above.
One of the questions we've been getting from the people that are watching on air and online right now, which is the way it'll stay until about 7 o'clock, then we'll go online only on KSAT.com and Trinity's Tiger Network. One of the questions that we just got is, what do we know what the possible side effects are from these vaccines right now?
So because the vaccines are very new, we only have a small amount of data. And the data we do have, fortunately, the worst severe symptoms described, at least from Moderna, were severe pain at the injection site, which most vaccines will have that, some redness. And the worst one would have been fatigue and a lot of muscle aches. So no different than maybe getting a flu shot for most individuals or a tetanus vaccine. If you've ever had the tetanus, it's very painful for the next day or two.
It sounds like when you're talking about possible side effects could be similar to when you get the flu shot. Is this vaccine going to work the way that a flu shot does? Are we talking about an injection of a live virus in this case?
No, so the vaccine right now, as it stands, is a two-part series. So individuals will get a vaccine today, for instance, and come back and get the second vaccine within 2 weeks. Again, this vaccine is mRNA, so it's not a protein, it's not a live virus. It's essentially instructions to tell your body to recognize COVID-19. With these instructions, your body can make its own antibodies to protect itself from COVID.
And that's the question. So we got another question from one of our viewers tonight. Is it going to set up like the flu shot, where some people get flu shots once and then 2 or 3 weeks later they get another one? Is that kind of how you see this vaccine setting up as well?
Correct. Right now we're looking at about a 2-week time frame. And we don't know how long the immunity may last. So we may have an update within 6 to 9 months saying that we have to redo the two-part series again.
All right, we're going to continue our conversation on COVID-19 and where we stand now, coming up next. We are back with Dr. Jose Plata from Trinity University, continuing our coronavirus conversation this evening. And Doctor, I want to go back to the vaccine. That seems to be the thing that's really on top of everybody's mind right now. And I hate to continue drawing comparisons to the flu shot, but that's the one that we all know, I think, the best and most of us get. So should we expect the COVID vaccine to be like the flu shot in the sense that every year there is essentially a concoction that doctors come up with, forget my incredibly layman's terms here, to give us in hopes that that combination will prevent flu that year? Should we be anticipating that's going to be the case with COVID as we move further down the road?
Fortunately, the reason that it's done for the flu shot is because there are multiple strains or multiple types of that flu. And we never really know which strain or which type is going to be prevalent or most common in our population. So because of that, when these vaccines are created, at least for the flu, most of our scientists are taking a wild guess based on prior patterns we've seen before. With COVID, because it is a brand new type of strain, and there aren't very many variables to it, we can hope that this one vaccine will keep us taken care of. Again, the unfortunate part is that the studies have not been around long enough for us to know how long the effects will last of the immunity from the COVID vaccine.
Oh.
Is there a need to get both the COVID vaccine and a flu shot?
Absolutely. People still die from the from getting the influenza out here. And even if you don't, if you are just battle it out and are able to recover, the last thing you want to do is to get your body weak and make yourself an easier target for COVID out there. So I would definitely get both. I already had my flu shot in September because work mandated it, but also I would still get it if it was an option.
What are the risks to someone who decides they don't want to get the COVID vaccine when it's available?
Fortunately, the COVID vaccine is only a recommendation. Because of religious reasons, personal reasons, you can decline it. However, the risk if you decline it is that your life may not be the same moving forward. So we've all given up a lot of freedoms and a lot of ability to engage with each other, with our loved ones. If I don't get this COVID vaccine, I'm not going to be able to make it to my friend's wedding in the spring or my sister's wedding this summer. And I would like to attend both events. So missing such key events in your life is going to be devastating to you, to your loved ones. From the medical standpoint, you're not going to be able to to do what you have to do. Sometimes diseases can be exacerbated, and in other instances, your job may even require you keep your mask and stay 6 foot apart from those who have had the vaccine, since you may still be a carrier for the disease.
All right, we've been getting some great questions from people who are watching us on air and online. This next question comes from one of those viewers. Any idea how the vaccines will affect pregnant women or people who have HIV or AIDS?
Yeah, so fortunately, the COVID vaccine was very, in the studies they did. They had some older patients, they had some patients with immunocompromised. So both pregnancy and HIV patients are essentially the same population. And we consider those to be immunocompromised or their defenses are a little lower than the rest of the population. So this has been proven so far to be safe. So if I had an HIV patient or a pregnant patient, I would definitely recommend it. So for their own safety to continue their management for HIV or for the safety of their newborn.
I want to ask on the other side of this break, we got to take a quick break really quick, but I want to talk about the COVID vaccine and kids, what we know at this point about the benefits of them getting it or any potential risks. We'll be right back. We are back with a panel of experts now from Trinity University to talk about COVID-19 and its impacts in our community. We're going to introduce them here in just a moment. But Dr. Plata, I want to go back to that question that we talked about just before the break, the COVID vaccine and kids. It's a concern for a lot of parents because this is so new. So what do we need to know about whether the vaccine will be available for kids or what the effects would be in them if they should receive it?
So an important date to keep in mind is December 10th. That is when the CDC meets to kind of give a step-by-step approach of who gets the vaccine first and in what order the rest of the populations in this country and in San Antonio will get the vaccine. Unfortunately, because we've all known so far that COVID doesn't affect children as frequently with severity, they will probably be the last patient population to be get the vaccine. At the rate that we're expected to grow, the COVID vaccine will potentially be available to them about springtime. So that's currently the goal so far.
All right, we're going to broaden this conversation out as we go forward. And so I want to introduce the rest of the panel. We've, of course, become acquainted with Dr. Jose Plata from Trinity University. We appreciate all that you've added so far. I want to introduce the rest of the panel. First, Dr. Christine Drennon. She is the Associate Professor of Sociology and Anthropology. Dr. Drennon, thank you for being with us tonight. Also, David Macpherson, Dr. David Macpherson, the chair of the Department of Economics at Trinity University, and Dr. Alfred Montoya, an associate professor of sociology and anthropology with Trinity. And we've talked to Dr. Plata. So, Dr. Drennon, I want to ask you first, if there's one thing that people need to know about COVID and its effects on San Antonio and the community, what would that be?
There's so many things, but it's common knowledge that this virus does not impact the population randomly, that some segments of our population, of all populations, are hit much more dramatically than others. And we see, and it's the same pattern here. And specifically in San Antonio, I'm talking about the Latinx population. The current statistics, and today's haven't come out yet, but as of yesterday, I'm looking at the dashboard right now, 76% of reported cases are in the Hispanic community, but our population is 65% Hispanic. So that's 10 percentage points greater than the population. It's only 17% of the white community, the Anglo community, has been impacted by COVID. I mean, physically impacted by it. Yet the population is between 25 and 30%, and it follows the rest of the country. But we're incredibly vulnerable because of the inequality and the poverty in this city.
Dr. Drennon, we are just beginning this incredibly fascinating and important conversation about these effects. We're going to wrap things up here on air on KSAT 12, but this conversation is continuing online on KSAT.com. That's where we will be live streaming the rest of this conversation. We'll be right back.
One more.
Yes.
All right, hey, doctors.
The standards that we created back in July, a certain percentage, depending on the prevalence within San Antonio, is what's going to come back. We were doing so well before we left that we were looking at the hybrid model. But now that we're over 10% and inching closer to 15% prevalence in Texas, it's going to be hard to try to buy that hybrid model.
Hey, everybody, it's Steve Spriester. Thank you all for being here. It's my first chance to actually talk to you when we're not on the air. So we have about 30 seconds on air that we're going to wrap up, and then we're going to go take a quick, 10-second break and go right into the online conversation. That'll take us up to 8 o'clock with an open and things like that. So I appreciate you all joining us. Dr. Macpherson, I want to apologize for the technical problems that we had earlier. So I'm thrilled that we got that worked out.
Great, thanks.
Yeah.
Can I ask one more question? So when will you make that decision?
All right, we're about 30 seconds away from the coming back.
We have just started scratching the surface about the impacts of COVID-19 in our community and what it has revealed about San Antonio, far more than just the physical side effects of this illness. Our panel of experts here from Trinity University sticking around to take your questions, which you can submit right now on our website at KSAT.com.
As well as the Trinity Network, we're going to continue this conversation online. But for now, that wraps it up for the 6 o'clock news. We'll see you back here on the Night Beat.
Cool. All right, a minute 30 till 7 o'clock. Minute 30.
All right, so we've got a minute 30 before we're going to do the online thing. Is there any questions that you guys have for us, for Myra or myself?
I guess expectations. You don't want us to talk over one another, and that happens all the time in these Zoom things.
Yeah, I think that's why I will call on specific people to answer the specific questions. But certainly, if somebody wraps up and you have something you want to add, I don't have a problem with jumping in and saying that as well.
Yeah.
Right.
Okay. So we'll wait then. We'll wait for your cue.
Sure.
I haven't
good.
introduced myself yet to the Zoom room. Myra, Arthur here with everybody. Thank you guys so much for being here.
Hi, Myra.
Hey.
We are 30 away.
All right,
Okay.
30 seconds away. The impact can be seen everywhere, at work, at restaurants, in many of our homes. It is a pandemic that has hit many people hard, from our health to our pocketbooks. COVID-19 has changed our world, but there seems to be hope in the form of at least 3 possible vaccines. Tonight, a community KSAT discussion in conjunction with Trinity University. Where are we now? What does the future hold when it comes to COVID-19? And how hard has our community been impacted? We also want your questions for our panel. This KSAT 12 special presentation starts right now. Good evening, I'm Steve Spriester.
And I'm Myra Arthur. Tonight, the first of 3 discussions on COVID and our own community. This evening and the next 2 Wednesday nights, we will be hitting on different topics with different experts, and we hope that you will be part of that conversation.
Hello to everyone joining us on KSAT.com and the Tiger Network from Trinity University. Let's introduce our panel once again. First, the Brady Bunch panel, I guess we're going to kind of say, because you guys are all stacked up here. We have Dr. Jose Plata, who is with Trinity University. We have Dr. Alfred Montoya, Associate Professor of Sociology and Anthropology. Dr. David Macpherson, the Department of Economics, the Chair Department of Economics. And Dr. Christine Drennon, Associate Professor of Sociology and Anthropology. All 4 of you, welcome to this discussion, and thank you for your expertise.
Let's start with you, Dr. Macpherson, if we can, because I feel as though obviously the physical side effects and the impacts to our health are top of mind when it comes to COVID, but I think the fallout when it comes to the economy is something that is giving everybody so much anxiety. Is there anything you think is unique about the way in which we have seen job losses and just the economic impacts of this? Because of course our country's weathered recessions before and seen plenty of layoffs for various reasons. What's unique about what's happened here?
I guess, well, the big thing is that it's really been concentrated in lower paying occupations and industries. And it's really affected one industry in particular more than anyone else, any other industry, and that's leisure and hospitality. And usually recessions are more broadly based in terms of what industries are affected. And it's also concentrated amongst, Hispanics, younger workers, those with less education, and women. So it's unusual in the sense that it's so concentrated amongst certain groups. Other sectors like government are barely affected in terms of job loss. So it's not broad based, but where it is affected, it's deep.
Has it been put in number figures yet, just how big this impact has been?
Well, the unemployment rate hit the highest since the Great Depression. At the peak, it was over 15%, and now it's down, I think, about 7%. And again, we've lost basically as of September about 10 million jobs. So we're not back up to where we were before, even though we've had a rapid increase in employment. And it's still off, particularly in leisure and hospitality, which affects San Antonio, obviously.
We're waiting to see whether another stimulus bill will be passed, whether additional aid is coming from the federal government. Do you think that would be enough? Is that the answer that we need?
We do need to get over this winter season because restaurants, for example, are really been hurt significantly by COVID. And they've been doing things like outdoor dining, as well as takeout and delivery services. But the outdoor dining is not going to work so well in the middle of the winter. And it's already, particularly in the north, had an impact on the industry. So these gig workers and other self-employed workers have been collecting extended unemployment benefits. They're going to expire at the end of this year. And so it's going to be a problem if we don't have those workers with additional income to get through before the vaccine starts to hit. So there needs to be sort of a bridge between where this stimulus bill that we passed in March expires and when the vaccine starts to have its impact on the economy.
Is there concern that when you're talking about conventions or hotel rooms or tourism, that some of these jobs just aren't going to come back? Is that a concern?
Absolutely it is, because one measure of that kind of problem is if you look at the share of those who are unemployed for at least 15 weeks or more, that means that they haven't been able to go back to their previous employer when they were on temporary layoff. And that has been continuing to rise all the way through this COVID recession. And that really is a reason for worry that we're going to have some long-term and lasting impacts that's going to last for years for some groups of workers. So that definitely is a concern.
We are currently working on an episode of KSAT Explains, all talking about the impact that live performance venues, bars, have had due to the pandemic. You talked about the leisure industry, and that's what really made me think of that. And unfortunately, those kinds of businesses have, the distinction of being able to say they were the first to close and they've been the last to reopen. We talked to some bar owners who had concerns about the city's workforce development plan and just saying that while it's a great effort, there were people who were out of work right now and in need of immediate help. What do you make of the efforts that have happened here locally to get our economy back up and running?
Well, the biggest impact has been the federal spending in terms of the stimulus bill, because that involved trillions of dollars. The amount of money that's spent locally is much more modest. And so I think one of the reasons why the U.S. overall has done better than other countries in Europe is that we provide a lot of stimulus to the economy, and that helped us get past the effects of the recession. And we had a quicker rebound in the economy because people had a lot of money that they were able to spend and increase demand for goods and services. So, the local effects, I think, are going to be much more modest than what the federal government can do and has done.
I want to move over to Dr. Alfred Montoya right now, who's in sociology and anthropology at Trinity. Talk about the the parts of our communities that are hardest hit, does it seem like when we're talking about the economy that they're not only hit economically, but also by the health concerns of COVID-19?
Yeah, absolutely. And so I'm a medical anthropologist, and I focus on what my students are already very tired of me repeating, which is the fact that disease and its distribution is profoundly social. And I think my colleague, Dr. Drennon, alluded to these aspects of our particular community that have sort of paneled disproportionately the negative effects of this pandemic to focus on particular parts of our community, people who are suffering from intergenerational forms of poverty, people who are persons of color, people who are working in the service industry, as Dr. Macpherson has alluded to. And so what we focus on then are the social determinants, or what we call the social determinants of health. These are the factors, the condition or the conditions in which people are born, in which they grow up, they go to school, they become employed or not become employed, and they labor, and then they grow old under these particular conditions. Also aspects of the health system itself sort of shape how something like a pandemic affects a particular population, such that, health outcomes in general, and life expectancy in general, and people's life chances, generally speaking, are shaped as much by these particular factors as the biology of the virus itself. And then these kind of factors we're mostly interested in when we talk about include, obviously, people's socioeconomic status, which in this community sort of maps on directly onto issues of race, to where which zip code one lives in, and so on. So in terms of the social determinants of health that affect COVID in our community, things like housing, people's education, people's access to healthcare and the quality of that healthcare when they have access to it, and certainly people's types of employment have shaped how this pandemic has moved through this population that may be different in other parts of the state or other parts of the country.
In that same vein, Dr. Drennon, let me pose this question to you. Can you talk about specifically the ways in which different parts of our own community have been impacted, perhaps disproportionately to our own population? What have we seen here?
So I'm just going to kind of continue this conversation because Dr. Montoya set that up well, and that like other cities in the country, our non-white population has been impacted at a far higher rate than the white population. The thing that is unique in San Antonio is number one, we're a city with a high poverty rate, but the second thing is we're economically segregated, so that not only has a portion of our population been hit at a greater rate, so too are they kind of spatially isolated into some parts of the city, and it tends to be on the not the north side. So what, if you look at even the maps that the city puts out every day, you can see these clusters, especially on the west side and going into the southwest side, which are Latino areas, Latino, and historically have always been, and they're also poorer neighborhoods. And so it's not that, it's what we need to do is to separate out the fact that, yes, it is impacting communities of color, but we also have to keep in mind that our middle class is Latino, is Mexican American descent, right? And our middle class has similar responses to COVID or similar infection rates as the Anglo or the white population. So it's not just that the populations of color are impacted. It's the lower income populations, right? It's not a matter of physiology. It's a matter of these social determinants. So these parts of the population that have not historically had the opportunities in terms of education, in terms of jobs, in terms of social mobility, they're again feeling the greatest impacts of this, and they're spatially segregated from some of the areas that have been able to withstand this kind of natural disaster that we're in the middle of.
It's interesting, Dr. Drennon, and I want to drill down on that a little bit more. I know before the pandemic hit, the rough dividing line in San Antonio was Hildebrand. If you lived north of Hildebrand, you had a longer lifespan than if you lived south of Hildebrand. So my question is, what do we do now? How can we, I mean, obviously it's a divided community that we live in economically. How do we make that better going forward? I know it's a tough question.
We have lots of time, luckily.
Yeah.
Well, and honestly, okay, so lots of things, right? We need to be prepared because it's going to happen again. It's just like I said, it's a natural disaster. If you live in New Orleans, you're going to get a hurricane again. How do you prepare? And you're preparing day to day, right? We need to be prepared in protective equipment. We need our hospitals to be prepared, but prepared long term, right? Over a generation. This means continuing to work towards those equity goals that our last couple of mayors have really kind of have set out as really the goals for the entire city, is to move forward so that everyone's life expectancy is as high as it can possibly be. Our zip codes to the northwestern parts of the city, out by Government Canyon, the life expectancy in those areas is 88 years old. The zip code 78207, which is where Dr. Montoya lives and grew up, which is right to the west of downtown, the life expectancy is 68. That's an entire generation. That's in one part of town, they get to see their grandchildren grow up. In another part of town, they never even meet their grandchildren. And that's what we need to overcome. So the question is, how do we do that? And I honestly think that some of the redistributional policies that we voted on, a month ago, are a step in the right direction. Yeah, they're not going to take place immediately. It's much longer term. But the fact that we as taxpayers are willing to take a little bit of our public dollars and redistribute them back into a population that has been denied investment for over 100 years is a step in the right direction.
Yeah, you're talking about pre-K. You're talking about pre-K for SA. You're talking about the VIA, and you're talking about the workforce development.
The workforce. I sure am. Those are public dollars, right? And so we as citizens of the city, as a body politic, are willing to say, yes, take part of my income, my public dollars, and put it back and put it back into this population that's been denied. I think it's enlightened. I think we've done the right thing, and it's going to take a long time, but it's a step in the right direction.
Dr. Montoya, you grew up here in San Antonio. You are very familiar with our community. You've seen it change a lot over the years. Do you think that this pandemic has only highlighted the inequities that were already in existence long before we ever had to deal with COVID?
Sure, I'm certain that is the case. And I've studied different pandemics. I've mostly worked on HIV prevention and control. I've worked a bit on SARS, the sort of original 2003 SARS outbreak in Asia. And so this is what pandemics do, right? They sort of disturb our sense of stability and our sense of normalcy, obviously, and they expose these fissures in our society. They tell us where we have been deficient, right? And they expose these pockets of deficiency, these pockets where we have ignored whole populations for far too long. And they tell us something about ourselves, about our priorities, right? And what we consider to be normal. For instance, I'm not sure that when we talk about returning to normal, we might ask ourselves, if it's normal to have such a giant percentage of our population working basically paycheck to paycheck and living sort of on the brink of catastrophes, that something like this pandemic can massively disrupt the lives of many of our community members here. And maybe that sort of normal is not really what we want to return to after things settle down epidemiologically here for us in South Texas. And I would like to second Dr. Drennon's call for all of our public policy initiatives to take a kind of perspective of equity, right, to sort of begin to reckon with some of these longstanding inequities that have shuffled resources from particular parts of our community to other parts disproportionately. And they've produced these outcomes health-wise and education-wise and income-wise for generations now.
So we've got a question, and that's why I've got my phone here with me, because that's how I get some of the questions from people that are watching us on KSAT.com and on Trinity University's website. And one of the questions is, and I guess I'll open this up to Drs. Drennon and Montoya. Somebody wants to know, let's say I'm living in a higher income area in San Antonio. What's the best thing I can do to help those that aren't? Talk about it.
Mm-hmm. Yeah. One thing is just to be really educated about it. And I think we also just need to realize that we're all implicated in it, in the fact that there's such inequality, and we've known this for years. I mean, it's been headlines in our newspapers for years that we come out at the top of all of these lists. And now this COVID is just kind of has made it all so real. And we all need to take some personal responsibility in that. I mean, I'm sitting right now in my office at Trinity. I have the door locked, the building is locked, and campus is shut down. I mean, I'm protected by layers of privacy and isolation to keep me healthy. And other places, other people are not. Yet we tend to say, well, they make bad decisions, right? And no, people just aren't. They're not, of course, like young kids who are going to go out, and I don't know, maybe Trinity students, whoever, may go out and make bad decisions. But in general, our San Antonio families are not. They're protective of their children, and they're still getting sick. And I think we as a society need to realize that we've created this, that our own actions in the decisions that we make about our tax dollars and about our votes create this. And we need to hold local government all the way up to the highest levels accountable, and be willing to say, my tax dollars, they don't need to go anymore into, certain parts of town. They need to go into these poor areas, and specifically into poor populations. I'm not saying to go in to some of these neighborhoods and fix the sidewalks, right? We've had those conversations for a long time. We need to get enough kids into great schools with tiny classrooms, for example, where they can learn well and learn in appropriate situations. We need to get every single one of those little bodies into pre-K for SA. And that's going to cost a lot of money. But then the next time that this thing rolls around, which we know that it will, with, 8 billion people on the planet, then we're more prepared. And yes, a natural disaster is going to hit us, but maybe not as non-randomly as this one has.
And kind of on the other side of the coin to that viewer question, what message would you send to people who live in one of these zip codes that has been disproportionately affected? The 78207 that you mentioned, Dr. Drennon. If someone is watching this and says, well, that's me, I'm in the zip code with a very high rate of spread for COVID, what would you say to them?
Let me talk to it briefly, and then I'm going to pass to Dr. Montoya because he's got personal experience. Is that right now we know that the transmission, and Dr. Plata probably knows this better than I believe, I've heard that the transmission right now, they believe to be the majority of cases are coming from places like big box stores. Right? People who are in public, even while wearing a mask. So yes, if you're in a population that's so much more susceptible to infection, this virus is everywhere. But some people, just because of their living conditions, are in places where it's probably more prevalent, in order just to avoid exposure and to protect yourself and your body as much as you possibly can. Some of us can't do that. Again, I'm in the 3 layers of protection over here, and somebody who works at the HEB can't do that. So it's being so mindful of your own physical presence and where you're going, and to try to limit it as much as you possibly can. But I'd like to hear what Dr. Montoya has to say about that as well.
I appreciate that. And I'd like to respond also to the other question that Dr. Drennon so eloquently sort of responded to, about what to tell our more affluent or wealthier neighbors here in this community. And I would say, supporting those initiatives and policies that are forward-looking, that look towards ameliorating some of these inequalities that have gone on for generations, right? Particularly those that are both the low-hanging fruit and also those initiatives that produce additional kind of multiplier effect benefits. So like education, for instance, initiatives that support more equality or equity within education or housing. We're coming to understand rapidly, of course, now in the context of the pandemic, that housing is also public health, that we also need to support people's ability to not become unhoused in order to support sort of general public health for the community. And finally, quite obviously, supporting those initiatives that make or create a more robust public health system. Right? So we have in this country for the past 40 odd years undermined and robbed our public health infrastructure, right? That used to be sort of one of the most robust public health systems in the world, where people had access to these kind of health resources. And we can also, no matter which part of our community we happen to live in, support these initiatives that will be at least a step in the right direction towards equity in terms of righting some of these sort of historical wrongs. And also, to my neighbors in 78207, my neighbors and friends, I would say, things have been rough for a long time, and we have formed, at least in 78207, the parts that I know, have formed sort of community mutual aid, helpful for lack of a better word, where neighbors are banding together, are sort of sharing resources, or making trips for each other to the grocery store so that people aren't sort of unnecessarily exposed or minimize their exposure to this community spread that we're experiencing. And I would just like to instead of sort of the usual thing, give a shout out, for lack of a better term, to those initiatives that are massively grassroots, right? Neighbors just sort of self-organizing, putting together their heads and trying to do the best under extremely trying circumstances for themselves, for their families, and for their neighbors. I think, in the place of some other kind of advice or suggestion, I would like to sort of give proper credit to those initiatives that I've seen, at least in the part of the neighborhood that I reside in.
And I want to talk to Dr. Plata next with Trinity University. You were instrumental in setting up some of the guidelines and some of the do's and don'ts when it comes to what happens on campus. A freshman from Trinity asked us on Facebook, could vaccines be mandatory for students when they come back, if we switch the conversation to vaccines?
That's a very good question. So that goes back to policy from the campus as well as the state of Texas or even the city of San Antonio based on Metro Health guidelines. We've had, I was telling some of my other Trinity colleagues that currently today the Texas Health Department released statistics saying that the positivity rate in Texas is at 14% over the last 7 days. What that means is that in the last 7 days, out of everyone that tested for COVID, 14% of them were positive. So if you saw 10 people last week, 1 or 2 of them tested positive. Trinity set really strict guidelines back in July before students came back on campus. So we set 3 different parameters and we labeled them by colors, and they're found online on the Trinity homepage. So we labeled them as green, yellow, and red to make it a little bit easier. If we're within the green, students are allowed to be on campus, just safe distance, safe measures, interact with extracurricular activities as needed. Right now, 14% essentially puts us right close to the yellow line, which means we would close, if we were on campus right now, still in classes, we would likely be talking about closing facilities like dining facilities and making them takeout only instead of dining. And we would probably be holding as many extracurricular activities. So that's definitely something that we will be deciding in the next few weeks. But again, we can only recommend, it's no different than the last few months. We've had students isolate or quarantine, still wanting to travel back home and do their isolation or quarantine in Austin, in Houston, or somewhere else with family instead of on campus. Clinically and medically, it's not fun for me to allow a student to travel 6 hours, 8 hours, expose other people just so they can isolate in the comfort of their own home, but I cannot force them to stay on campus. So very similarly, Trinity will likely take a stance where we highly, highly, highly recommend you take the vaccine. If you don't, you may be prevented from doing fun stuff like extracurricular activities, sports, or band or anything else, but we cannot force you to do it.
This gets to a lot of the questions that we've been getting from viewers specifically about the vaccine, and I'll start with you, Dr. Plata, and open it up then to maybe the sociologists that are with us. But how do we as a society convince the naysayers that the vaccine is necessary? Many people don't have the confidence that is required, and some people are just anti-vaccination.
I want to not just convince, but kind of put people's minds at ease. The technology for this COVID vaccine has been around for years. It is brand new technology, never used for vaccines before, but it has been studied since at least 2013. So a lot of students, a lot of patients feel uncomfortable that, hey, this vaccine was pushed too quickly due to political reasons, money grabbing reasons, but not really. This type of technology has been around for 7 years. What is new is that we're using this technology to be able to protect us from a new virus that has spread across the world and creates very deadly and long-term complications. So I would do it for yourself, for your loved ones, and even just for a social setting. Some people may be forced to do it to go back to work. If you want to go back to home or back on campus and engage in the life that we had before the COVID pandemic started, it's definitely going to be highly recommended. So don't listen to the naysayers. There's always going to be naysayers for everything out there.
Dr. Montoya, I want to ask you next. I mean, how big an obstacle is this with people not wanting to get vaccinated?
Well, I haven't actually sort of looked at the data. I mean, from journalism and those kind of things, it seems like there's a significant portion of sort of the national community that has some trepidation about taking this vaccine. In terms of, as you mentioned, the anti-vax movement that predates, of course, COVID for quite a bit. I mean, there's a certain amount of conspiratorial thinking, I think, that drives, and other scholars have written about this, that drives some fear, unfounded fear regarding other vaccines, like for the flu or for measles and mumps and rubella and that kind of thing that has been widely studied and sort of examined. I would add also that there is sort of generally here in this country and in Texas, particular, low levels of science literacy, I think, which also compound the ability of policymakers or experts and health professionals from convincing people that something like a vaccine is useful, is a useful tool in epidemiology or in sort of public health protection, population protection in general. And I think tackling sort of our woeful levels of science literacy may go a long way towards producing at least a generation of people who have more confidence in these processes, who understand the processes that vaccines have to go through, that all pharmaceuticals have to go through in order to be approved, et cetera. And so that might lessen, at least in the long term, some of this sort of fear and anxiety around these kind of newly produced agents.
Yeah, and lessening that fear, I think, is really important, especially when it comes to educating people. I hope that's how we take a step in that direction. So, Dr. Plata, a viewer question that we got, you mentioned that new technology a moment ago. A person is asking about that. What exactly is the mRNA vaccine? How is it different from traditional vaccines?
Yes, so that's absolutely what Dr. Montoya is talking about. A little bit of science literacy is going to help us a long way here. So if we go back to high school and early college biology, we've all heard the terms DNA, RNA. The difference, DNA tells us who you are, what you do, what we believe we're in. RNA teaches us and teaches other cells certain items, certain proteins, how to create them. So RNA, we can think about it right now as basic as a teacher. This vaccine is basically made out of mRNA. Since 2013, mRNA has been studied. It initially started with trying to use this technology to target certain cancers. However, we found it pretty useful in this case, to target COVID-19. And the difference from this to traditional vaccines from before, every vaccine in the past was either a real virus, for example, the shingles vaccine or the yellow fever vaccine, or an actual small part or antibody of the virus or a little piece of protein. So it's either the real thing or a part of the real thing. Whereas the new vaccines right now, it's actually the RNA, the teacher. So it has information that's going to teach your body, hey, here is how this virus looks, make a protein to protect yourself. Whereas before, we were injecting the real virus or a small portion of it and essentially letting your body learn on its own to create some antibodies.
You talked about this mRNA being looked at for cancer treatments. Is there anything right now that people routinely get that involves mRNA? Are we already using that technology to treat people on a wider scale?
Not yet. A lot of our studies are being used for some high prevalent cancers that really target most people. Lung cancer is a big one always, liver cancer, renal cancer, but it's not out there yet. The only reason COVID-19 was able to be brought to production so quickly with mRNA technology is that the US government threw almost $1 billion to Moderna to be able to create this. The time and the money spent for the other parts that mRNA could be used has not been taken advantage of just yet.
Dr. Drennon, I want to ask you a question about, obviously we talked about education being so important in getting people wanting to get this vaccine. Are you also concerned about accessibility when it comes to some of these communities that we've seen? We have seen highly successful flu shot drive-through clinics that have been sold out. You know, we've seen people lined up for food. Are you concerned about accessibility when it comes to this vaccine?
Absolutely, absolutely, because we have to divide out kind of opportunity from capability, right? We may have the opportunity out there in San Antonio, out and beyond, I don't know, millions of doses of this vaccine or whatever. I don't have the proper vocabulary for it. But if somebody doesn't have the capability to access it, it doesn't matter, right? So questions about how much is it going to cost? How do I get there? Where is it going to be made available? Through which kind of clinics or schools or drive-throughs or whatever. So the questions about, reaching different populations are so much more complicated than just, we have it, it's here, it's in the city, yay for us. It's also how do we reach a very differentiated population? And I don't want to make it sound like it's insurmountable, because it's not. But we just have to be so aware, and I think our public health department actually is. I have tremendous faith in them, about how do we reach these in some cases very hard to reach, not because they're far away, but because people speak different languages, people don't have access to transportation, people don't have actually access to something like this. We've got this really interesting conversation about like hardcore amazing science, but being translated to someone like me who's not a not a physical scientist, not a biologist. So I'd never heard this thing before about M something, and it's absolutely fascinating, and it gives me a more hope and more faith in this as well. But I'm lucky enough to have access and the capability to be part of the conversation. And that's what we have to be aware of. Just because this will in the next couple of weeks arrive here, how do we reach people?
Dr. Macpherson, I want to make sure you haven't been left out of this conversation. I want to bring you back in here as well, because I think all of these different aspects of COVID, they're all intertwined. One affects the other. We have seen when news about the two vaccines from Pfizer and Moderna came out, we saw the stock market was impacted by that once we saw how effective these vaccines are purported to be. Once people start being vaccinated, do you think that's going to have any impact on our economy in terms of getting people back to work or boosting productivity from all of the people who've been working remotely for so long? Do you see any impact when it comes to the vaccine and the economy?
You're muted.
I think you're muted, Doctor, if you can hit the unmute.
The line of 2020, you're on mute.
Yeah.
Sorry. I didn't want to have my dog barking. I think it'll have a big impact on the leisure and hospitality industry, which has been so negatively affected by the virus. So I think it clearly will have a big impact and help the economy rebound strongly in those sectors. So I think that's probably the best way to help the economy is get the vaccine spread throughout the economy quickly, the population.
It seems to me that unfortunately people, as they tend to do in this country, take sides in this whole thing with either I'm for science or I'm for the economy, when it seems to me they go hand in hand. Do you agree with that?
Absolutely. I mean, I couldn't agree with you more.
Talk about, one of the questions that we got from viewers has to do with the stimulus money that has been put out for COVID and for businesses and for other things. Is there a point where putting out that much money becomes untenable for a government and for our economy?
Oh, one has to be really careful, because there is so much money being printed by the Federal Reserve, in essence, that people aren't spending. If you look at how often dollars are changing hands in the economy, we call that velocity. It has dropped substantially in the recession. It's partly because people are uncertain about their future, so they keep money in checking accounts and they don't spend it. And so we had savings rate that hit over 30%, which is extremely high earlier on in the pandemic. It's dropped now to about 14%. But it's a fine line the Federal Reserve has to have with regards to inflation. And so it's tough. I mean, it's potentially a real problem. But in the short run, we do need to have stimulus to help us get through to the period when the vaccine does spread through the economy. So having another stimulus package to get us through the next few months would be good. But one has to be really careful after that they don't overstimulate the economy.
Do you have any predictions of your own, or based on research you might have seen, about how long it's going to take our economy to get back to where we were pre-COVID?
Well, actually, the Congressional Budget Office said it would take until 2026 to get back to fully where we were before. Wow. In terms of employment. Now, in September, we're down 10 million jobs. So it is going to take a multiple of years. So, having stimulus in the economy would be helpful. It's just one has to be careful that all this money doesn't get spent at once, and so prices just go up quickly.
One of the questions that we have is people want to know, will closing gyms and bars and restaurants negatively affect our economy here in San Antonio? And what about the citizens that Dr. Drennon and Montoya are talking about? Doesn't this hurt their income as well? I think that's kind of talking about the balance here between science and the economy.
Yeah, there is. I mean, that's why we have the increased unemployment benefits. And I think this compromise bill that's the centrists in the Senate are proposing is a good idea, because their idea there is to increase unemployment benefits to help people through this time period of when they can't open the businesses. Well, if you make it more profitable, like we did initially, to have $600 a week of unemployment benefits on top of the mandated unemployment benefits, that encourages people not to go to work. In other words, they make more on unemployment than they can working. So having it more moderated so that they don't make more on unemployment than working, I think is a good idea. So one thing that a lot of economists have suggested is to go out and improve the unemployment systems that these states run. The reason why they went for the $600 week benefits additional was because they couldn't program the computers sufficiently to prevent people from earning more than they could on their jobs before layoff. So I think that'd be a good infrastructure investment in the future.
Can you talk about specifically San Antonio's economy? Because as we've mentioned multiple times here, hospitality, tourism, they have both been hit so hard, and they are so integral to our own economy. How do you think that we are weathering this storm, if you will, as a local economy, and what will it take for us to bounce back?
Yeah, and perhaps what will our economy look like post-COVID?
Well, I mean, one of the bigger sectors in San Antonio is leisure and hospitality. And right now, jobs are down 10% in that industry relative to before COVID hit. Now, one thing that San Antonio has done relatively well overall relative to other cities in Texas, as well as the country as a whole. So I think we're in better shape than most. That said, some sectors like leisure and hospitality are going to take a while to rebound, and you really need that vaccine spread throughout the country and the city to get people to go back to conventions. I mean, there's no way I'd go to a convention without a vaccine. And I don't think many other people would want to go into a room with a lot of people without having that protection.
Can I comment on that?
Absolutely.
Of course.
Because it's such an interesting question, and I think even Dr. Macpherson alluded to it before, but the question was, how long will it take to rebound, and when will some of these industries come back? But the other question is, sure, when will it come down in terms of maybe rates of employment? But it could also rebound, and maybe this is not a bad thing, in a very different form. Right now, we're heavily dependent on hospitality and tourism. Should we be? They're not. For some, those are good and exciting jobs, but for others, you are not going to send your kid to college if you work in hospitality. And maybe it's an opportunity, and that's again why I think the referendums are interesting. Is maybe it gives us an opportunity to re-envision the future of our local economy, and where do we fit into the regional economy. President-elect Biden talks about, as we shift away from fossil fuel vehicles into green vehicles, that's not the loss of jobs, that's retraining and retooling. And can we begin to think about our position in an evolving economy rather than going back to what we were?
And I
look forward to that conversation.
Yeah, and that's a conversation I want to add to that a little bit. I remember doing an interview with then Mayor Julian Castro, and he was talking about changing the focus of the way the San Antonio Economic Development Foundation went out and looked for jobs. He basically said, we have enough call centers. We have enough of those kind of things. I want to change the focus. Are you seeing evidence, I'll ask you, Dr. Macpherson, and anybody else on the panel, are you seeing evidence that focus has changed in any considerable way?
I haven't seen much evidence of a big change. I don't know if anybody else has, but still there's over 100,000 jobs in leisure and hospitality in San Antonio. It's still one of the bigger sectors.
Manufacturing, I know, was something that got a boost prior to COVID. We had the announcement of a lot more money being poured into the Toyota plant. I don't know that we ever got a figure exactly on how many of those jobs would be coming here. Another truck manufacturing plant coming Navistar,
yeah.
Thank you, coming to our area as well. So I wonder how those kinds of investments could be impacted by COVID. Obviously, COVID's halted everything, but when it comes to advances we were trying to make, what do you think the impact could be there?
Well, actually, economists are not usually big on paying for firms to move jobs to, a manufacturing plant in San Antonio or anywhere else, because it's really a transfer from the taxpayer to the firm. So, actually, a lot of economists would like to ban all the subsidies that firms get to move jobs to a particular location. Hate to be Debbie Downer on it, but it's
not in favor of it in general.
But pardon me?
I said, so not in favor of it in general.
No, exactly.
But
not just in San Antonio, because you see who's paying for the jobs, and sometimes they can be very expensive. Is that the people who aren't getting subsidized are paying for the people who are getting the subsidy.
Dr. Drennon, are you seeing any evidence of the focus of jobs being brought to San Antonio changing? I know we've seen some local efforts like Code Up and some other things like that in getting people more literate in coding and doing some software things, whether it's at Rackspace or other places in town. Are you seeing any evidence that things may be shifting? Is there hope that we can change our economy post-COVID?
Hope, yes. Evidence, no. So, so I agree on that one. And then, you know, I remember it was Mayor Taylor who had said the best jobs are the jobs that we grow up locally, right? And we are the most entrepreneurial city, I think, in the country. And in terms of, you know, you go to different parts of town and everybody deeply believes that they can open and run their own business, right? Tire shops, tattoo parlors, you know, little tiny restaurants. It's fantastic, the economic energy in this city. And she was right in that, is that how do we encourage that kind of local job? Is it, you know, the other thing I said though was, can you send your kid to college? I don't know, but you sure can own a business, right? And that's it. That's an equivalent. So, you know, and that kind of doubles back on some of the, you know, the workforce referendum we just had, and which fields that they've identified. And I think that they are fairly traditional. I think it is hospitality, it's medical, it's high level manufacturing. But also just, you know, just if we can encourage small business also, is just, it's still where the energy is in this city.
Dr. Drennon, you mentioned hope. I think that no matter your socioeconomic status, what your job is, what's giving us all hope right now is that vaccine. So Dr. Plata, I want to pose this question to you, though. I think there's been a lot of word of caution since we've heard about the efficacy of the Moderna and Pfizer vaccines, that this does not end a pandemic once we get that vaccine. What do people need to know about the fact that we're in this for the long haul?
What people should know is that with the vaccine, you're going to gain confidence. You're going to gain confidence to be able to dine inside a restaurant instead of the patio. You're going to feel a little bit more comfortable going to the gym and taking care of your own body and your own mental health. You're going to feel comfortable going to go see loved ones. So absolutely, this is for the long run. There's going to be a subset of the population who will not get the vaccine because of whichever reason. And they may be a source of potential small outbreaks throughout the city and throughout the state or country. So we just have to be very cognizant and careful, but ultimately the vaccine should help us move forward with our day-to-day lives.
Any idea the cost of vaccines? I know that Dr. Drennon talked about this a little bit, that's obviously a barrier to a lot of people, is what these vaccines could cost. Any word on that?
Absolutely. So CMS, or the Center for Medicare Services, has put out a statement saying that for all Medicare and Medicaid beneficiaries, they will have access, which are the patient populations most at risk because of their ethnicity or their medical background or age, that the vaccines will be given to them at no cost, so no copay. Same goes for most private insurances. So the fact that, unfortunately, you know, a lot of employment is tied, or insurance is tied to employment. So in addition, Congress passed some legislation recently, part of the CARES Act, that even though you may be uninsured because you lost your job or simply could not afford the coverage, that you should be able to receive the vaccine at no cost to you. And the cost of the vaccine for those who are uninsured will be covered by a special pot of money that Congress set aside.
So many questions surrounding the vaccine. That's, you know, the majority of what we've been getting from viewers tuning in tonight or watching this online. One of those questions, if you get the COVID vaccine, can you still spread COVID to others?
No, and it all goes back to the technology and the type of vaccine this is. The types of vaccines that can spread to others after you get them would be a live vaccine. So the real virus going into your body, the most common. In the past, we used to have, if you remember, the flu vaccine, a live version, which was a mist that some people would get. The shingles vaccine, the yellow fever vaccine, those are all live. So if it's the real virus, which is alive, you have the chance of being infected yourself more than just what the vaccine would provide and spreading it to others. Whereas COVID is not the live vaccine, it's not a virus, it's just a teacher showing your body how to respond to COVID if and when it's exposed to it.
So another question we got was about asthma. I know obviously the respiratory issue, the concern, that's the huge one with COVID. Do we know if people who have had asthma have been involved in clinical trials? Is it safe for somebody who has a respiratory condition to get the vaccine?
I can't tell you much about the data from the Pfizer vaccine. It was made in Germany, but Moderna made in the States. Most of the trials were done here. And 30,000 patients were part of that. Part of those 30,000 patients, Moderna did a great job in giving us little subsets of populations. So patients over the age of 65, patients who have HIV, patients with asthma, COPD, rheumatoid arthritis, lupus, chronic kidney disease, you name it, they were part of this study. And the good thing was that if you got the vaccine, you did not have serious side effects of the vaccine or of COVID if you were exposed to it. The side of the other 15, so 30,000 split into 15, 15. The 15,000 who got the placebo, there was a patient who died, but again, they got placebo. They didn't get the real vaccine. And unfortunately, that's a very unfortunate event. And the others who did not die had very severe side effects. So they had to be admitted into the ICU or into the hospital. Whereas none of the people who had COVID on the people who got the vaccine even made it to a hospital setting or ICU setting.
All right, so this has been a fascinating conversation, but we want to wrap this up as close to 8 o'clock as we can. And I want to give each of you a final word here, something that you want to leave our viewers with tonight. And Dr. Drennon, I'll start with you.
Can I start with a question for Dr. Plata that's been on my mind? And you're going to laugh. But one of these vaccines has to be stored at like -60 degrees.
-80 degrees.
-80. Okay. So if it's stored at -80 or it's ineffective, how do you get that into my body without killing me?
The problem with the Pfizer vaccine is the stability of it and being able to preserve it at that rate. So it's like it has to do with what we talked about all night, socioeconomics. So people in big cities and high affluent areas will have Pfizer because they have the resources to store the vaccine this cold. So San Antonio,
it's going to feel really cold when it goes in my arm.
It shouldn't. No. It's only done for storage. It'll go back to room temperature after injection.
All right. Sorry.
The Moderna vaccine may likely be used in socially disadvantaged settings.
That's the Dolly Parton one, and that's the one that I want. Yeah.
You admire both.
That's right.
Yeah, it's personal hero. But you know, as we move forward and as we kind of shift our conversations from the immediate to the future and thinking again that there will be another natural disaster and we will be impacted. We need to work so diligently in this city on moving toward equity, so that a virus or a weather hazard, yes, we're going to be impacted by it, but it's not certain sections of the population that carry the burden anymore. And we've done this, we created this through policy and through action and through geography, the way that we created our city. We did this very intentionally through history. And now we have to be as intentional as in undoing it and correcting it. So that's where I hope the conversations will shift within the next year.
Dr. Montoya, to you, any final words that you want to leave us with tonight?
Sure. I'd just like to reiterate, first of all, thanks for allowing me to be part of this excellent panel. It was a great experience. But I just want to reiterate sort of the two aspects that condition how a pandemic moves through a population. First, obviously, is the biological aspects of this particular pathogen, right? How we get it, how it's transmitted, etc. Shape, how it moves in a given place, but also, and the part that Dr. Drennon is alluding to, the kind of sociological aspects of this is the part that we have control of, right? And it's equally important to address those issues in terms of trying to protect our community as a whole. And these will have to do, even, as we've been discussing, and people are attending very closely to this vaccine and looking towards it and it's spurring hope and so on. The vaccine should also understood as one tool amongst a whole other range of tools that we already have at our disposal, right? So the vaccine is excellent, but we also need to attend to these issues of equity that Dr. Drennon has laid out for us, but also to maintain our vigilance, right, in terms of the speed and depth and duration of social distancing and mask wearing and so on, these kind of sort of very, very basic epidemiological practices that we've known about since the time of the bubonic plague, right, that have served us as a community for several 1,000 years and so on. We also need to attend to making available those resources that we require, personal protective equipment for those people who are working in healthcare settings. We need to expand, not bring back, our testing and surveillance system, right? Increasing contact tracing and investigation, increasing our vigilance in terms of isolation and quarantine measures and so on. And finally, and this is sort of something that we've been discussing for the last hour, is to attend very, very closely to those populations that have been left behind, those parts of our community that have not received adequate attention healthcare-wise or housing-wise, or in terms of transportation or education and so on. These include, obviously, elderly persons, people with immune problems, people with pre-existing conditions, people who are living in densely populated circumstances, people who are homebound, that massive sort of part of our economy that's working hourly wages, that can't afford to miss a paycheck, that must go to the HEB or must go to the motel or wherever it is that they find their employment. And also in general, in this community, people of color and the impoverished, right? People who are, as we've mentioned before, experiencing an overburden or a heavier burden from this pandemic than other parts of our community. People who are less likely to be insured, to have access to healthcare and so on, who are more likely to have pre-existing conditions that will exacerbate their COVID infection if they become infected, and so on. And so that was sort of two aspects, I think, are what I would like to leave people with, both the biological aspects and the sociological aspects that condition how something like this pathogen affects our community.
Dr. Macpherson, what would you like to say to people tonight that are watching?
I think to really prevent some of these long-run effects, negative effects of having people unemployed for long periods of time, I think passing a stimulus bill before the end of the year so that we can bridge this time period now till the fact when the vaccine is fully deployed in the population, I think it'd be really helpful. It'd be a worthwhile investment that would pay off dividends by not having people who are long-term unemployed for years, because it can be real scarring effects from recessions. And we had that with the Great Recession, and we could have this again with the COVID recession. That is, we can get people back to work quickly and get them financially able to survive this next few months until the economy's back to normal. I think that'd be a worthwhile investment. And if this bill that's right now in the Senate can get passed, I think that'd be a good compromise.
Dr. Plata, let's end with you. We've spent so much time talking about vaccines this evening. What final word would you like to give all our viewers about COVID-19 and where we are now?
The final word would be, who are you getting the vaccine for? I'll be getting the COVID-19 vaccine as soon as it's available to me so that I can continue to stay healthy, to continue to earn a paycheck. And most importantly, for my mother and for my brother, because I know that if they catch COVID-19, they may not survive it. So I'm doing it for myself and for my loved ones and for my ability to continue to earn a paycheck.
One final question for you, Doctor. Are you concerned that people are suffering from COVID fatigue?
Yes, you can see it everywhere. That's exactly how I caught COVID. We had been in quarantine from February to June, and a moment of weakness where I decided to go and interact with more people than I should have without a mask, closer than 6 feet, and that's how I caught COVID-19. And a story for another day, but there's still some side effects that are present 6 months later. So absolutely, we have COVID fatigue. Don't fall prey to it. Don't let other people convince you to do stuff you know is wrong.
Dr. Jose Plata from Trinity University, Dr. Alfred Montoya, Dr. David Macpherson, and Dr. Christine Drennon. We all appreciate your time, and we are all in this together. So there's a fascinating conversation. I could go on for another hour, but I know you guys have lives. So I want to thank you for taking your time for us tonight, and I want to thank the viewers out there for the great questions that you provided this evening as well.
Thank you all so much for being with us.
Thank you.
Thank you.
Have a good night.
Good night.